This is a podcast by the Straits Times.
If you're struggling right now, right, if some of the things that we talk about resonate with you, there are a lot of resources. There are helplines available. So at SAMH, we have a toll-free helpline. It's manned by trained counselors. If you feel like you're struggling alone, you can just reach out, give us a call. There's also other resources like the National Mind Line 1771. It's 24 hours, so it's also manned by trained counselors. So just want to let people to know that when people think about seeking help, they think of trouble, right? It's so troublesome, but it's not. You just pick up the phone and you call, right? That's the first step. And if you want, then we can help you arrange a counseling session if it's necessary. But if not, just a short phone conversation, to talk to someone about it.
And my line is free of charge, right?
Free of charge, yeah. SMH, our helpline is also free of charge. And in fact, our counseling is also on a donation basis. Yeah, so it's free of charge.
Hi, I'm Joyce Teo. Welcome to Health Check. So today we're going to talk about grief and how to manage it. People think of grief as something that happens only when you lose someone. But that's not the case, because you can grieve the loss of a marriage, a job, a home, even a goal that you have had for many, many years, or even a pet. We can also experience grief when we're diagnosed with a major illness or like a mental illness. So grief is something that many people will experience in their lives. So for this topic, we have invited a counsellor from the Singapore Association for Mental Health, or SAMH. So SAMH is one of the few social service agencies focusing on mental health here that operates a general helpline for the public. We have Lin Jing here today. She's one of the 4 counsellors from the Insight Centre at SAMH. Lin Jing has counselling experience with young adults as well as with seniors dealing with the loss of health and spouses. She holds a Master's of Counselling from the Singapore University of Social Sciences. So in the podcast, she will tell us about grief and what to expect and what grief counselling is all about. Hi, Lin Jing. Thanks for joining us in the studio today.
Thank you for having me, Joyce.
Yeah, we're going to tackle quite a heavy topic.
Yeah.
Grief involves coping with loss, right? And, my good friend lost her father last year. And I have another friend who lost her marriage this year. So most of us haven't been taught how to process or recognize the complex emotions that can arise when we're grieving, right? Can you talk about the stages of grief that a person might go through, and then the signs that he or she might experience?
Yeah, of course. Like you said, grief is a very universal human experience, even though it's heavy. And when we talk about the stages of grief, we often reference the 5 stages. There is denial, there's bargaining, there is anger, and eventually move towards acceptance. I think it's helpful to know these stages because it just helps us to know grief is made up of many emotions, not just sadness. But at the same time, I think it's important to know that grief doesn't move in a linear manner. Many people do not experience all those 5 stages, also not in a particular order.
Oh, I see.
Yeah.
So you mentioned the 5 stages. So there's denial, 1, there's anger, there is bargaining, there is
Depression.
Yeah. But not everybody will get there.
Yes,
and then
correct.
there's finally acceptance.
Yeah.
I see. Okay. It's quite complex, right? 5 stages.
Yeah.
And, the next question would be like, how long is the process, right? Typically, if I just do a quick search, right, I've read that, a person might be grieving for like 6 months to a year. And then there is this expectation, society does expect people to kind of like move on after a while.
Yeah.
So what's your thoughts on that?
I often tell my clients that there's no expiry date for grief. So, and they don't have to feel the pressure to let it go or move on. Whenever we see like a general guideline that maybe the acute symptoms will happen within the 6 months or 2 years, but over time what happens is that people will still experience what we call these like punctuated moments of sadness, but over time it will become less frequent and more bearable. It will always come back, and it could be a part of our life.
Oh, okay. During like maybe anniversaries. And...
Yeah, special dates, like anniversaries, birthdays, special occasions.
Right.
And it's also important to know that grief can show up anytime, unexpected as well. For example, I recently had a client who broke down when he saw a social media post about suicide prevention. And because he lost a family member to suicide many years ago. So moments like this will remind us that grief doesn't follow a timetable. Even after years, it could still resurface. And like we mentioned, this emotion can be a mix of sadness, longing, guilt, or even anger. You know, if you picture someone who's thinking about their loved ones, all the memories flooding back, they could be sad and at the same time feeling angry, thinking how can bad things happen to good people, right? So we don't want to look at these stages as completely separate, but it can happen all at once. And when it comes to signs to look out for, I think it's also helpful to differentiate feeling grief and coping with grief. So if you can imagine someone sitting in their room, holding a picture of their loved ones and just cry and cry until they feel drained. So that's when they actually feel grief and allow themselves to be affected by it. Coping, on the other hand, might look like avoiding certain places or keeping themselves very busy, distracted, or just going numb so that they don't feel anything, right? So at the end of the day, whether it's the direct expression of grief or the avoidant behavior, they're all part of the grief journey. Yeah.
Do you have any examples of how it affects a person's lifestyle?
Yeah, so an example that came to mind is a client actually reached out because she has difficulty at work, right? So she noticed that she started to make mistakes that she usually wouldn't make. And she thought she's so-called getting over it already because it has been over a year. But she just find it very hard to focus at work or find it hard to be around people. And that's how grief can kind of become this whole body experience, right? It affects your energy level, affects your appetite, affects your sleep and your ability to concentrate or socialize.
I know somebody who's managing grief, right? He lost his grandmother and it's been a while and it affected his life, his relationship. Do you have any advice? And, for people who's around this person struggling with grief, right? What should they expect and, what can they do to help?
That's a very good question, and I get asked that a lot. I think if we're concerned about someone who's going through grief, just keep an open mind. It's important to not compare our own grief experience with other people's grief experience. So just ask what's it like for them, and rather than making assumptions or jump into this problem solving, or suggesting them to take a break, to go on a holiday, things like that. Just encourage them to open up, to express their grief. Because ultimately, grief is like any other powerful emotions. It needs a witness. It needs to be heard. It needs to be understood by other people.
Oh, right.
Yeah.
So to give them a chance to talk about it.
To talk about it, yes.
Right. Without judgment.
Yeah, without judgment.
But for the person, who's experiencing it, right? Because they experience it at their own pace, how would they know if they need help?
I would say when you find yourself finding it hard to resume your life, right? Meaning that you find yourself missing work, right? Your relationships feel like it's falling apart, or even basic self-care becomes difficult. And that's the time I think people should really reach out and get professional help.
Right.
Yeah. There's another point. I've worked with a lot of clients who on the surface, they're coping well. They're still fulfilling all their commitments, but inside they feel very, very miserable and lonely. So I would say if you feel like you're carrying grief all by yourself and there's no one else that you could talk to, or you feel that people cannot understand you, not because they don't care, but maybe because your loved ones do not have the capacity to support you the way you need. So that's also the time when you can just reach out and find a trained therapist or counselors to help you navigate the loss. Yeah.
To talk through it, right?
To talk through it, yeah.
Right. Before we talk about what grief counselling is, right, I just wanted to say that people think of grief as something that happens when you lose someone, but that's not the case, right? Because it is something that can accompany an event that challenges your sense of normalcy. So it can be the loss of a job, a home,
Yes.
or fertility even, right?
Absolutely, yes.
And-
yeah. Or health,
Oh, right, a health, like a significant
a diagnosis,
health
a
challenge.
chronic illness. Yeah.
Right.
Yeah.
So would it be the same? I mean, would people dealing with these losses also go through the same stages of grief and the complex emotions as well?
Yeah, it's possible, but then again, we know people experience grief differently based on their personality, based on the nature of the grief. Maybe there's cultural and religious factors as well. But yeah, because grief is a natural response to loss, and there can be many different type of loss. I think you have mentioned a few of them. And there's also what we call anticipatory loss. For example, if our loved one is diagnosed with dementia or a chronic illness, we may already start grieving while they're still with us. And another type of grief that's often overlooked is grief for normalcy after trauma. So if you think about someone who survived a serious accident or maybe lost their savings to a scam or perhaps lost their childhood due to neglect or abuse. So these experiences can change people in a very profound way. So it might become very difficult for them to ever feel safe again, to trust people, to form close relationships. So that's also a form of grief. So it's important to help them recognize this loss and start grieving for this loss. And that can be a first step towards healing.
Right. So grief counselling is for anyone dealing with the loss, right? Because typically we associate it with somebody dealing with the loss of a
Bereavement,
person.
yes.
Yeah. But it can be any of these losses, right?
Yeah, it can be any of these losses. So what we notice is that most of the time people coming for counseling saying things like they're anxious all the time, they're feeling depressed, or lost their motivation, not knowing that what they're experiencing is actually a normal response to loss. So just simply naming their experience as grief can be very powerful, because then it kind of shifts the narrative from there's something wrong with me, I'm a burden to other people, I'm mentally unstable, to a narrative of just simply acknowledging that I've lost something that's meaningful to me and then I'm grieving it. Yeah, so it can really take the self-blame and shame away.
Right. But then a lot of the times guilt is also involved, right?
Absolutely, yes.
Yeah, so if guilt is thrown into the picture, it's not quite about, I don't know how to even explain it, it's so complex. Because you're guilty, your relationship with somebody that you've lost may not be good.
Yeah.
And, how do you navigate that?
I would say the first step is to normalize it, to know that this is a part of the grieving process, right? So we might expect ourselves to feel guilt, not just sadness. So understand that it's okay to feel these emotions. Because a lot of times what happens is that people tend to resist it because these feelings are so unpleasant.
Yes.
And it makes us spiral, So what we do is we want to push it away. But a lot of times in therapy, we try to help people to feel safe enough to actually give themselves permission to feel all these things. It can be guilt. It can be anger. It can be any emotions, right? So, and that's how the emotions can lessen on its own, right? Rather than really control our life and making us feel that it gives us a sense of agency over the emotion rather than being controlled by it, if that makes sense.
Yes, that sounds very difficult.
It sounds very difficult, yeah. So there's skills that we can learn. It takes, you're absolutely right. It sounds easier said than done. So it takes a lot of intention and mindfulness to actually allow ourselves to feel these difficult emotions.
Right.
Yeah.
And it's challenging on a daily basis. So how does grief counseling help with that? Do people go in and just talk through, what they are experiencing?
Yeah, that's the first step, right? Because a lot of time people reach out because they might not feel safe to openly express their sadness with their loved ones, right? So just simply having a space where they feel safe to talk about their experience or to cry, that itself can be healing.
And can you give us an example of how it happens? Like the process, So first you talk through it and then...
Yeah. For example, let's say the client told me this incident of walking past a restaurant, right, that they used to visit together. And she just suddenly feel being hit by waves of grief, right? So I use that as an example to show her how it's possible to feel grief while still being okay at the end of it, right? So I use this acronym called NICER, not nice, but NICER. It stands for noticing, inviting, and curiosity, and embrace, and finally return. So NICER. So for example, when she noticed the unpleasant sensation, just simply notice like what's happening. The thoughts, the memories flooding in. Maybe there's a sensation of tightness in her chest or throat. And just invite them in rather than push them away or judge herself for feeling these emotions. And look at the emotion almost like a messenger trying to deliver an important message, right? So we just invite them. And curiosity, just be curious. Oh, I wonder why I'm feeling this way, right? Oh, it's because this place reminds me so much about them and I'm grieving now. So it just help ourselves make sense of it. And then the embrace part is just about letting all emotion in. There could be the bitter sweetness of the memory. It could be guilt. It could be anger. It could be a lot of emotions get triggered. And at any time when she feels it's too overwhelming, we will teach people to use their breath, just gently breathe into where it hurts the most. So that use that deep breathing as a way to anchor themselves, to ground themselves. And finally, the returning part is about how do we help ourselves return to the state of being okay again, right? So a good question to ask is, what's the kindest thing I can do to myself now as I'm going through these difficult emotions? It can be finding a quiet place to sit down, buying yourself a drink, or just allowing more time for this emotion to pass, right? Until we feel okay again, until we feel settled. Yeah. So practicing this doesn't mean that the grief will go away, right? It's still there. It's just make it more bearable and it softens the pain. And it gives us a feeling that we still have control over these feelings.
Right. Sounds like we need a lot of patience as well, right?
Yes, we need a lot of patience with ourselves. Exactly.
Right. And also the people around us.
Yeah.
It would be good to be aware of that, I guess.
Yes, correct. Yeah.
Okay. So I wanted to get to a little bit of the difficult emotions part, right? Because it's just from my own experience with my friend, right? When she lost her father, the relationship wasn't very good. It became even more complex. There's a lot of guilt. How do you resolve that? How do you go about thinking through that?
Yeah, I think in this case, I would probably encourage your friend to just talk about what's happening between her and her father. Because I think as loved ones, we have this tendency to distract them from the pain, right? But actually what helps is to encourage them to talk about their loved ones. Yeah, what's he like? What do you like about him? What do you dislike about him? Yeah, just things like that. We encourage them to talk about it. And usually along these conversations, the emotions will show up. And then all we have to do is create space for these emotions to let them know, yeah, of course you will feel this way. Of course you will feel angry. Of course you will feel guilty.
Does the guilt go away after talking through your feelings and your emotions?
Again, go back to that expectation we always have for things to eventually go away, right? I like to use this analogy. So whether it's sadness or guilt, it's like a stone that you carry in your pocket. It's always there. You can feel it. But what happens is over time, we become stronger. So the stone feels lighter. The stone never changes. It's always there. But because we learn more skills, we become more resourceful, we become more resilient. So it just feels more manageable, more lighter, and more bearable. if that makes sense. But it might always come back. The thing is, we might never be able to so-called get over it.
But guilt makes it more complex, isn't it? Because the person has died. If you're talking about bereavement, right? There is this guilt and you can never make up for it.
Yes, yeah. That's what makes it very hard for the person to move forward, right? Some practical things that might help is, for example, write a letter, because like you mentioned, it's the fact that I can never have that closure. There are certain things I want to tell the person, but I will never get the opportunity to say it. Yeah, so sometimes writing a letter, express it, just pour down all the emotions and thoughts and the things that you want to say. And that helps sometimes. And you don't just have to do it once, whenever you feel like it, you can write down, because our feelings and thoughts, it might evolve over time. Yeah.
I think that's a very good tip.
Yeah, and you can even create a ritual. I will write a letter every year, around the anniversary of the person's birthday.
Right. When we talk about the guilt, right, that's, I don't know whether there's such a thing as positive guilt, but I was just thinking the other guilt might be because you're so angry. And would that help as well? You will scold the person through writing this letter.
Yes, exactly. Absolutely, scold away. Yeah.
So because we're talking about grief counselling, right? But some people might get confused because there are like psychotherapists out there, there are also psychologists out there, and there are social workers that you can talk to.
Yes,
What's the difference between talking to these different mental health professionals?
In Singapore, actually, counselors and psychotherapists are used interchangeably sometimes, and they can help the client talk through their issues, provide a safe space, make sense of their distress, and maybe identify some of the patterns that keep them stuck. And psychologists, on the other hand, can also do those things. And on top of that, they can provide a clinical assessment and offer more specialized intervention. So I think when it comes to finding the right help, the most important thing is finding someone who you feel comfortable with, right? Who you feel you can actually open up to without censoring or filtering yourself or worrying that you might be judged.
Okay. So that means the therapy that's provided, that might differ as well, right?
Correct, yes. So I would say if you find someone that you can talk to during the first session, don't be afraid to ask questions. Can you share a bit more about how do you go about supporting people? What kind of modality you use? What kind of experience you have? What kind of approaches that you use? Just ask questions and get to know more. Because they are the service users, right? So it makes sense for them to know.
Right.
Yeah.
But I don't think, the general public might be aware of these different therapies anyway. So, I read that you're trained in emotionally focused therapy and cognitive behavioral therapy.
Yes.
Can you just briefly tell us about these therapies?
Yeah, of course. So cognitive behavioral therapy is one of the most commonly used therapies because it gives us a lot of tools to use, right? So it's especially effective for people who come in and want a solution, right? So usually we will help them understand the thoughts and beliefs behind their feelings. And then we gently challenge them. Or is it really true that, for example, your girlfriend broke up with you because you're unworthy of love, right? So sometimes it's not the breakup that can really create the pain. It's that core belief that I'm not worthy of love. That's why my girlfriend broke up with me. So we help them understand these beliefs and these thoughts that they're having. And then we help them to form maybe a more healthy self-belief. Yeah. And emotional focused therapy, on the other hand, is we focus more on their feelings. And then, for example, if the person say that, I just feel so painful when I'm reminded of my loved one in the case of grief. And actually, we will help them to locate that pain, right? Where do you feel that pain? Because usually people don't think that way. They think that sensations and feeling are separate things. But if you really think about it, when we're experiencing heartache, it's a physical sensation. We will feel this tightness in our chest, or some people describe it as someone's pulling my stomach, and when they're about to cry, they feel that throat is tightening up. So when we focus on the emotion, we also focus on these physical sensations, and we help them to lean in or being more tuned to these feelings. And then we just look at them as discomfort. It's not good or bad, it's discomfort. And simply have a goodwill towards themselves. How do I help myself to feel more comfortable now? Because I don't want to be suffering. Yeah.
To kind of expect that, right?
Yeah.
And to not be surprised. And
yes, correct. Yeah.
and it sounds like the stages of grief as well, and then you try to accept it. In the end.
Yeah.
Oh, okay. So it sounds like when people go for counseling, it can be a combination of these therapies.
It could be a combination, yeah. Some people are more cognitive. They like to learn about theories and how to understand things. They like tips, like 5 steps towards healing, for example. They are the type of people who want very concrete solutions.
Right.
So CBT is definitely good for them. And some people, they are more in tune to their body. So that's when we might help them to overcome these difficulties by actually focusing a bit more on the physical sensations and feelings. Yeah.
Okay. When will somebody who's going through grief know whether they need to go for like a deeper therapy, if there's such a word for it? So I guess what I'm asking is the difference between grief counseling and I've seen like grief therapy, where you actually go in there and go through a program to handle the grief. Would it be different?
That's a good question. I think if we step back and then we think of grief as a natural response to loss, right? So it's not depression, it's not anxiety, it's not a mental health condition that requires intervention per se, right? So the only reason why people might need therapy is because, like you mentioned, it becomes complicated. Some of the patterns or some of the guilt becomes so overwhelming that it's actually preventing the person from grieving. So that's why therapy can become very helpful to help them notice these patterns and not rushing them into grieving, but just help them notice these patterns and how they are making them stuck.
Okay, so that's like another level, because earlier when you talk about the stages of grief, that's depression as well, right?
Yes, absolutely, yeah.
Okay.
And in my experience, usually around the earlier phase when the person experienced loss, they do not want therapy. Meaning that if they really sit down and then they might tell you that I don't need therapy, I just want the person to come back, right? I don't need CBT, I don't need emotional focus therapy. I just want that person to come back, right? So I think we respect them. We don't want to force people or push people to go for counseling, because I believe our body naturally knows how to pace it. So that's why some people only begin to grieve months or even years later after the loss, when they finally feel strong enough, or when they finally feel that they have the space and resources and support they need to really let them feel the pain, or give themselves permission to feel the grief. Yeah.
So you could experience this stage of like numbness maybe for a while.
Yes, absolutely, yes. So there's a lot of what we call the delayed grief, right? And this can also happen when, especially immediate family, after the person passed away, they will become so busy, right? Organizing the funeral and rally the family members, doing communications and all that. So they don't even have the time and space to grieve. Yeah.
But you mentioned years as well. So you
Yes, it could be, yeah.
go back to life and then do whatever you need and then grieve years later.
Yes. And usually this happens more often around young people. For example, imagine a teenager lost a parent, right? So at that young age, they don't have the capacity to comprehend what's happening. So when the pain is too overwhelming, it's natural for them to just shut down. So they might just focus on playing games, right? Or doing other things. So because they don't know how to process it.
So when they're older...
When they're older, yes. Right. You can finally come back.
And then go through this grieving process.
Correct, yes, yeah.
Okay, that's painful. But what about a parent who loses a child then? Because nothing is as traumatic as losing a child.
Yes, I would say that's one of the most hardest loss to experience, which is when a parent lost a child. That really need a lot of patience for themselves and also the people around them, to really give them the patience.
So what's a typical stage? Do they go through the 5 stages, or is it normal for them to experience this numbness because of the shock?
It really depends. It really depends on the person. I remember a client told me that she had never felt like she has went through any of the stages. So for her, the grief after loss feel like just an ongoing moving back and forth between two states, feeling okay and feeling like a mess. So meaning that there could be weeks or even months went by without her thinking of her child. But then suddenly she could be pulled back into that deep sorrow with all the memories flooding back and feeling angry, feeling all sorts of emotions. And then eventually she will go back to that okay state again. So, but what happens is over time she noticed that these moments of intense sadness, it becomes shorter, it becomes more manageable. So I think perhaps that's a more realistic way to look at grief rather than it moving through stages, but it's more like an ongoing oscillation between hope and loss, between looking forward and just thinking about the past. Yeah.
Sounds very difficult.
So for these people, I think really grief would be a lifelong thing. Yeah, they will never be able to fully let it go. So normally we tell them that it's possible to create a life around the loss, rather than thinking, oh, I need to let this go. No, they don't, right? Because as long as they love that person, the memories will always hurt, right? But it's possible to move forward with the loss together. So it becomes part of them.
So having said that, some people, when you lose somebody, right, you keep the room, you keep all your things as they were years back.
Yeah.
Is that a good idea?
I think, again, it depends. Yeah. So if you're noticing that they start to withdraw, meaning that they become preoccupied with going through their loved one's clothes or belongings, and then they kind of isolate themselves. And it's because of that isolation that's when we want to intervene, not because the fact that they keep all the loved one stuff. Right.
Right.
Yeah, so again, we go back to looking at how are they coping. Like, are they able to carry on their day-to-day life? Yeah, are they able to eat, rest, move their body, do the basic self-care?
Okay. Mental health professionals, they can help grieving individuals deal with the self-defeating thoughts, these painful life patterns that make your suffering even worse. Right? Can you tell us more about that? And, what are these painful life patterns?
Yeah, absolutely. So the idea is that grief itself, sometimes it's not the only source of pain. And it's also the old patterns that we bring into the grieving. So, for example, I have many clients who grew up in a family where emotions were never talked about. So they might recall as a child when they tell people how they feel, it was usually met with dismiss or criticism. So they adapted to that environment by believing that their feelings don't count or their needs are an inconvenience to other people. So when they lost someone as an adult, their instinct is to keep everything inside and be strong, and appear as if they're not affected by it. So it's tricky because on the surface level, it might look like they're coping okay, but inside they feel very painful and lonely. Right, so that's when the therapy can really be effective because we can help them notice that their struggling doesn't just come from the loss. It comes from this lifelong pattern of appear as if they're okay when they're not.
Right.
Yes. So, and the goal for therapy is to help them feel safe enough to at least get a taste of saying, I'm not okay, and still be accepted. No one's angry, no one's mad, right? And so that eventually they will feel more comfortable to express their issues and not pushing people away when they need them the most.
Right. To actually talk about it.
Yes.
Tell ourselves that it's actually okay. Let go of the emotions.
Yes. Or just admit that, I'm not okay. I'm grieving and it hurts.
Interesting. I mean, I was thinking this be strong thing because it's so common, right?
It's very common.
Especially in Asian societies.
Yes, yeah.
So would it work if you actually embrace it, that it's okay not to be okay, and then to, would you say, let go of this thought or emotions?
Yeah, absolutely. Yeah. And a lot of times people feel like it's not okay to let go of the emotion is because deep down, for example, if they feel like if I start crying, I would not be able to stop. right? It's almost like opening the floodgate. Right? So I always tell people that it might sound scary, but I can promise you that you will be able to stop eventually. It's not possible for the tears to just,
like
keep
non-stop.
flowing.
And it's actually good to let it out, right? To cry.
Yes, it's cathartic, it's therapeutic to allow yourself to cry. Yes.
And it doesn't matter. You can cry many times too, right?
Absolutely,
Yeah,
yes.
not to judge yourself.
Yeah.
Earlier when you talk about grieving that might last for life, right? It will go away, like you said, but just know that maybe during certain episodes it might just come back.
Yes. And unexpectedly also, right? Around special dates, anniversaries, we can kind of anticipate it, but sometimes it will just pop up because there can be many triggers. Sometimes it's our own memories and sometimes it's external triggers.
Okay, so we're coming to the end of the podcast. And then I just wanted to get your advice for somebody who's listening in, who's dealing with grief, right? And then finding the loss very, very hard to bear. What's your advice for them? Are there actionable steps that they can take?
Yeah, absolutely. I think I've mentioned some of the tips earlier. The first step is to give yourself permission to grieve. So when you feel like the grief is hitting you, if it's possible, just let it run through your body.
To maybe find out where it hurts, like you said.
Yes, and knowing that it's a normal, natural process. It doesn't mean that you're weak. It doesn't mean that you're failing. For example, if it still feels heavy after so many years, it doesn't mean that you're failing, right? It's just a natural process, right? You can never be in the wrong place when it comes to grief. Yeah, if it hurts, it hurts. Yeah, all we have to do is to create space and be patient with ourselves and be kind towards ourselves as we're going through this painful. I would call it an episode because I wanted to remind people that if you're going through grief, it's temporary. It's not going to be pain forever. Yeah, if you really allow it to run through your body, eventually it will lessen, it will soften, it will dissipate. Yeah. And the last thing I want to say is if you're struggling right now, right? If some of the things that we talk about resonate with you, there are a lot of resources. There are helplines available. So at SAMH, we have a toll-free helpline. It's manned by trained counselors. If you feel like you're struggling alone, you can just reach out, give us a call. There's also other resources like the National Mind Line 1771. It's 24 hours, so it's also manned by trained counselors. So just want to let people to know that when people think about seeking help, they think of trouble, right? It's so troublesome, but it's not. You just pick up the phone and you call, right? That's the first step. And if you want, then we can help you arrange a counseling session if it's necessary. But if not, just a short phone conversation, to talk to someone about it.
And my line is free of charge, right?
Free of charge, yeah. SMH, our helpline is also free of charge. And in fact, our counseling is also on a donation basis. Yeah, so it's free of charge.
Okay, that's less pressure on the person.
Yeah.
Thanks for listening to this episode. It is part of our No Health Without Mental Health series. If you find yourself struggling a lot with grief, or if your grief feels like it's too much to bear, or you have difficulty resuming your life, please reach out for help. We have included helplines in our show notes. Do look out for more stories and podcasts in this series. You can find the links to the microsite and our stories in the show notes. This episode is edited by Amirul Karim. Thanks for listening.
Send your feedback to podcast@sph.com.sg. Find us on Apple Podcasts, Spotify, or within our Straits Times app. Thanks for listening.